I mean, first of all, Medicare, I can't understand how you are implying that healthcare reform is going to cut Medicare coverage, because it's simply not. It's nowhere in the bill that anything's going to get cut. In fact, it's going to provide savings to Medicare by cutting the profit to insurance companies. So I don't understand where that came from. But my question for you is that, I mean, you talk a lot about individual mandates.
Can I go first to the Medicare issue? You just said that, well, the bill would basically pretty much got the Medicare Advantage program. There are about 27,000 people in this congressional district who get their Medicare through Medicare Advantage.
And Medicare works really well, right?
I think it's a
government-run plan.
I think it's a good program. The problem
is, it's a government-run plan.
The problem,
and it's great, and everybody here loves it.
Hold on, let me finish. Look, whether you're a Democrat or Republican, independent, moderate, conservative, liberal, I think we all understand facts. And the facts are that it will go broke in about 10 years. I mean, that's a fact. I mean, it's not.
If we don't reform it, right?
That's right. If we don't reform it, that's not an opinion. That's just a simple fact.
I agree.
Okay. Now that said, the bill does deal with Medicare Advantage. There are other reductions. I met with the Delaware Valley hospitals today in Sellersville. I represent a lot of people who are served by Grandview Hospital, and they all, yes, there are at least $155 billion worth of cuts that they're concerned about overall for Medicare in the legislation. I mean, that's their cuts.
So you agree? So you agree? Medicare is a government-run plan,
yes,
much like the VA, and you think that works very well.
Well, I think, look, do I think Medicare is good? I think Medicare is good, yes.
Yeah.
But I also understand...
So a government can run a first class?
Well, let's go. Is
that what you're saying?
One at a time. Rather than get into argument, look, I just want to be very honest. I want to be completely honest with everybody here. When Medicare was established in 1965, there were a lot of estimates as to what Medicare would cost. And I think it's fair to say that the Medicare program has exceeded the costs of those which... far more than was projected. Okay, that's a fact, and there are a lot of reasons for that. There are a lot of reasons for that. We don't need to argue all those reasons, but it's happened. I believe that the costs associated with this bill, this is over $1 trillion. I believe the costs in this bill are understated, even with all the taxes, the surtaxes, the employer mandates, and the Medicare cuts. You still will run a deficit in the first 10 years of $239 billion over 10 years, and after that, the deficits go up much greater than that. So, I mean, I think the costs here are understated, and that they will be much greater than projected. The federal government has not done a particularly good job over the years in projecting the costs of these programs. So I just want to make sure we go in with our eyes wide open.
My point about Medicare is that there's going to be savings cut from the profits from insurance companies, and it's going to have nothing to do with patient care.
It's coming out of the hospitals.
My question is about the public option, because you're talking a lot about individual mandates, which there is nothing. There's no form of an individual mandate besides for children in this bill.
No,
there's an employer mandate.
No, there's an individual mandate.
For other than children?
Yes.
Who?
2.5% of income. Let me find it. You know what, rather than me run through the bill, I'm going to go find the page here real quick. But there's an individual mandate, 2.5% of income.
One of the bill, and just in the House bill.
In the House bill.
Right.
HR
which hasn't been merged with the Senate bill yet, and the Senate Finance Committee.
The Senate still...
Right.
The Senate's going in a different direction.
So, but either way, the public option is exactly that. It's an option. So, I mean, to say that everybody's going to be imposed to a government takeover is untrue, because you can opt to go into a government option. Every single poll that I've seen, so far says that over 90% of people are going to stay on their private insurance plan. Every single poll that I've seen.
Is there a question here?
Yeah. So every single poll that I've seen is that there's 90% is going to stay on the insurance plan. So I don't understand. How can you justify your position?
If the employer
how can you justify your position that a public plan is going to limit choice, which you say on your website? That it's going to limit the choice, when in fact it increases choice for people. When a majority of polls say that 90% are going to stay on their private insurance.
Okay, when the healthcare commissioner says your company's health insurance policies are not deemed acceptable, and then the employer says, well, maybe I'm paying 15 to 20% of payroll, and my policies aren't deemed acceptable by the federal government, maybe they'll say, well, maybe rather than continue to provide these benefits to the employees, they'll say, well, we'll drop the coverage, and we'll pay 8% of payroll, and now you're in the public plan. And then that's where the diversion comes from. So somebody can intend to keep you in, but if your employer says, we're not going to continue to offer insurance, you will be disrupted. And that's why these groups, it's not just the Lewin Group, there are others who are saying millions of Americans will be diverted. So there will be, I believe, less choice, not more choice. Now you mentioned the individual mandate on page 167, section 59B, tax on individuals without acceptable health coverage, tax imposed. In the case of any individual who does not meet the requirements of subsection D at any time during the taxable year, there is hereby imposed the tax equal to 2.5% of the excess of its on income. So it's, I mean, that's in the bill. So, we'll, sir, right here. This number right here.
Is anyone in the room eligible for Medicare and not on Medicare? Is one person? Did you prefer a private insurance company?
I have a special arrangement.
Okay. Is there anyone in the audience who is eligible for Medicare who chose to go to Blue Cross Blue Shield for insurance instead? Is Medicare working for you?
Yes, absolutely. Yes.
There are different numbers. I mean, a lot of people are going to move from private coverage into the government option. Now, there are a lot of impacts in this bill. I'll be very candid with you. You know, I spent yesterday, I was at Lehigh Valley Hospital much in the morning, met with some heart doctors, was in the burn centers. Yesterday afternoon, I went over to Guardian, the insurance company. They have 1,500 people working over there in Bethlehem. They said because of the way that just the dental coverage provision in here, they said to me will cost 300 to 500 jobs in Bethlehem. 300 to 500 jobs, just on the dental provision. And I had to go find this in here where they make references to oral health. Not a lot of references to it, but the way that dental services would have to be sold would essentially put 300 to 500 people out of business right in Bethlehem. Now, I just...
How?
What's that? Well, I have to find it.
I would love to know.
Yeah, well, because you have to bundle the services. You couldn't sell the dental coverage separate. It's not deemed... What's that? I'm talking about the people who work over here at Guardian. I'm just telling you what they told me yesterday. Don't shoot the messenger. I'm just telling you what they told me. I'm just telling you what they told me. They said...